Hello, and welcome to today's webinar on enteral nutritional formula prior authorization and how to use the New York State Medicaid Interactive Voice Response System, or IVR. I'm Rita Guido from GDIT, and we're hosting today's session. I'm going to turn the meeting over in just a moment to Tom Heckert, but in the meantime, I just want to remind those of you on the meeting that during the session, the phone lines and the session audio will be muted. But we do ask that you also mute your audio and phone lines from your end as well. So at this time, I also want to mention that today's session is being recorded, and we will be posting the recording soon if you do know of anyone who wasn't able to attend today's session. All right, Tom, I'm going to turn the meeting over to you now.
Yes, good afternoon. It's a small, but I'm sure a very interested bunch of people we have today. We are glad that you all chose to spend some time with us. We are going to talk today about how to use the IVR, which is the Interactive Voice Response System for enteral approvals. We have some of our staff here today, Trish Chipola, Eileen Stewart and Sarah Chatton. Sarah and Eileen are part of our nursing review staff, and they'll be able to answer any questions you may have about that review. Trish just put up the agenda today. We're going to go through the topics listed here on your screen. Just a quick little review of the manuals, and the notations of what they mean, the review of the policy, using worksheets, the prescriber worksheet, as well as the dispensing providers worksheet. How to enter things in the IVR, little tips and tricks. Sometimes it can be very tricky. And also activating, which is the dispensing, and some frequently asked questions on what to do if you run into some issues. I don't anticipate we'll use the whole time we have allotted, so you'll be able to get out earlier today and maybe enjoy a little bit of this beautiful day outside here. And with that, I'm going to turn it over to Trish and Eileen, who are going to do the presentation.
Okay, thank you, Tom. Thank you, everybody, for joining. We are going to, as just a reminder, go through the slides, and then we will go through the eMedNY.org website and show you how to get to some of the resources that we are describing in the training. So we'll get started. When reviewing the DME manual, note that those HCPCS codes displaying an asterisk require an authorization via the Interactive Voice Response System to prescribe or dispense enteral products. Dial 1-866-211-1736 to initiate the authorization process. The department's enteral nutrition information can be found in Section 4.2 of the DME Procedure Code Manual. Full policy information and documentation requirements can be found in Section 4.2 of the DME Procedure Code Manual on eMedNY.org. This benefit is limited to up to 2,000 calories per day for members who are tube-fed or members with inborn metabolic disorders, children up to 21 years of age who require liquid oral nutritional therapy when nutrients from food cannot be absorbed or metabolized, orally fed adults with a diagnosis of HIV infection, AIDS, HIV-related illness, or other disease or condition and require supplemental nutrition and have a BMI under 18.5 are allowed up to 1,000 calories per day, or require supplemental nutrition, demonstrate documented compliance with an appropriate medical and nutritional plan of care, have a BMI under 22, and a documented unintentional weight loss of 5% or more within the previous 6-month period are allowed up to 1,000 calories per day, or require total oral nutritional support, have a permanent structural limitation that prevents the chewing of food, and a placement of a feeding tube is medically contraindicated. Both the prescriber and dispenser worksheets can be found on eMedNY.org in section 4.2 or page 34 of the DME Procedure Code Manual. The worksheet follows the IVR prompts to help you obtain or activate a prior authorization for enteral nutrition. With your completed prescriber worksheet on hand, dial 1-866-211-1736 to initiate the prior authorization process. We recommend placing your phone on mute so the system does not pick up any background sounds. The IVR will prompt you to enter the responses on your telephone's keypad. When prompted, enter the client ID in numbers on the telephone's keypad. For example, if the client ID is AB12345C, when prompted, enter 22123-452. The system will then ask you to verify only the letters of the client ID. When asked to clarify the first digit, you should enter 1. A is the first letter on the number 2 key. When asked to clarify the second digit, you should enter 2. B is the second letter on the number 2 key. When asked to clarify the final digit, you should enter 3. C is the third letter on the number 2 key. And now I'll hand it over to Eileen.
When requesting an authorization for enteral products, you may be prompted to enter the ICD-10 diagnosis code. Please note that the diagnosis code should be specific to the reason for the enteral nutrition and not another underlying medical condition. For example, if a member has a primary diagnosis of cerebral palsy and has a G-tube for the diagnosis of dysphagia, you would enter the diagnosis code for dysphagia. You should enter each digit using your phone's keypad. For example, if the member's diagnosis is Z93.1 and you are asked to enter the diagnosis code, you should enter 9931 with no decimal point. Z is on the number 9 key. If the member is eligible to receive enteral products, the IVR will issue an 11-digit PA number. Add the PA number to the prescription and the prescriber worksheet for your records. The member can take their prescription to any participating pharmacy, pharmacy DME, or medical supply vendor to be filled. Dispensing providers must call the IVR to activate the PA for the initial fill and for all refills. There are situations where a prescriber is not issued an authorization number through the IVR, such as when the member requires more calories per day than the policy allows, or when the product code must be changed before all refills are used, or a new provider must dispense the product. A paper prior approval or an electronic prior approval through ePaces should be submitted with a valid fiscal order and a letter of medical necessity for manual review. Prior approval information can be found at the link below. An approved authorization can be canceled only if the authorization has not been activated by the dispensing provider. If the authorization must be canceled, dial 1-866-211-1736 and follow the prompts to cancel. You can then request a new prior authorization for the member through the IVR. If you are the dispensing provider, it is necessary to activate the authorization. With your completed dispenser worksheet on hand, dial 1-866-211-1736 to activate the prior authorization. The IVR will prompt you to enter responses on your telephone's keypad. The following are frequently asked questions that we often receive. Who can call the IVR to initiate an enteral authorization? The prescriber, an employee of the prescriber, or an employee under the supervision of the prescriber can call for the authorization. Dispensing providers, pharmacies, or DMEs may not initiate a prior authorization for enteral nutrition. What is an inborn metabolic disease? Inborn metabolic diseases are a group of rare genetic disorders in which the body cannot properly turn food into energy. Examples are phenylketonuria or maple syrup urine disease. Is gastroesophageal reflux, also known as GERD, an inborn metabolic disease? No, GERD is not an inborn metabolic disease. Does the Women, Infant, and Children, or WIC program, provide enteral products? Yes, the WIC program does provide some formulas for infants up to 1 year and must be utilized prior to New York State Medicaid. A list of WIC-approved formulas can be found at the following link. How many refills are allowed through the IVR? For members that are tube-fed, have a diagnosis of inborn metabolic disease, or are children up to the age of 21, 5 refills are allowed through the IVR. Adults with a BMI under 18.5 are allowed up to 2 refills and can receive 2 authorizations, each with up to 2 refills per year. Additional product will require a paper prior approval. Can I call the Department of Health, OHIP, and obtain an authorization over the phone? No, review staff are not able to provide authorizations over the phone. You must call the IVR to obtain an authorization for enteral nutrition.
Okay, and what you see now on the screen is a contact email address and phone numbers if you're having issues obtaining authorizations for enteral products, or if you need clarification on policies and procedures and so on. So what we're going to do now is go through the eMedNY.org website. Just give me a moment while I get to that site. Okay, so you should see the eMedNY.org landing page on my screen. And what I'm going to do is I will go through the provider manual section. And when I get to that provider manual landing page, I will scroll down to DME and click on that link. And as referenced, the information we're looking for is in the procedure code section or procedure code manual. So we'll click on that. When that document loads, one of the few tips that we'll give you is if you press Control F, it'll bring up a find function in your web browser. And if I search enterals, it'll bring up, or enteral, it'll bring up the occurrences in the document. So I'm going to scroll through to get to the section 4.2 for enteral therapy. And you'll note that this does provide the appropriate HCPCS codes with an asterisk indicating that the IVR authorization is required for enteral therapy. So the enteral nutritional formula benefit coverage is listed in this document as well. Any of the documentation requirements, as well as additional information such as where to find the dispenser worksheet, the prescriber worksheet, and the enteral product classification list, which will give you the HCPCS code for commonly used products. So just for ease of transition, I'm going to not click the link. I'm going to go to the prescriber worksheet. And we would like to note that you should have the member's chart available to assist when completing the prescriber worksheet. Once you've completed the prescriber worksheet, we ask that you have the worksheet on hand when calling the IVR. The worksheet, you'll note, it does have information specific to the prescriber, asking for the prescriber type, as well as the transaction type. Is this a new request? Is this to cancel an authorization? Are you inquiring about the number of calories already approved for a member? The system will ask for the provider's NPI, as well as the client ID number and date of birth, and a phone number where you can be reached. The IVR will then go on to ask specific questions related to the member's enteral nutrition. And there are a full set of instructions on page 2 of this document. Okay, next we'll go to the dispenser worksheet. The dispenser worksheet is for dispensing providers who must call to activate an authorization for enteral products. It will ask the dispensing provider for the prior authorization number, the client's identification number, the dispensing provider's NPI, as well as your category of service as a dispensing provider, and a telephone number where you can be reached. It then will go similarly to the prescriber worksheet and ask questions specific to the member's enteral product. Okay, and now we will go back to the contact information, and I'll hand it over to Tom.
We will be posting this online on the DME page, the presentation, so you'll be able to have other people listen and watch that. And we will look into putting these slides up on the website, also on the DME provider manual page. Yes, and we do encourage you, I mean, on the screen now, there's our email address and our telephone number. If you do have any, questions on specific instances or about the policy, or, questions on, just about anything, enteral related or medical supplies related, feel free to contact us, and we will get back to you with an answer as soon as we can. We'll wrap this up. We do thank you for attending. Again, if you have any other colleagues or people who may want to listen to the presentation, keep an eye out on the DME eMedNY page. We will be posting this there fairly shortly. And Rita, I think we're done, and thank everybody for coming.
Thank you, Tom. And just as a reminder to everyone, if you do have any questions after today's session that relate to any billing related issues, you can always contact the eMedNY call center at 800-343-9000 as well. So thank you all for attending.